Tell me what's kind of your conceptualization of PTSD, because that's like probably the number one thing we hear when it comes to veterans.
Yeah, well, veterans are very often exposed to extreme situations. The thing is that they're repeatedly exposed to them. There's kind of a cumulative effect to it. And so people in uniform tend to get PTSD symptoms that aren't really tied to a single specific event. And that's one of the big limitations of the DSM's interpretation right now, is their criterion A, which is how the DSM tries to conceptualize cause, what does and doesn't cause trauma. It's quite frankly inadequate to describe what causes PTSD in veterans. I don't really want to break down into various subtypes of PTSD, but one of the most common things that veterans go through is a moral injury. It's more about they acted or had something acted upon them that really went against their moral system. And psychologically, it's hard to come to terms with that. Not to get morbid, but an experience of that is in our most recent conflict. Some of our enemy combatants would strap explosives to children and tell the children to charge forward operating bases, forcing soldiers to eliminate a threat that messes them up psychologically, and it makes it harder for them to serve their country. So there are a lot of psychological variables that I think cause PTSD that isn't direct fear of death, if that makes sense.